Hi, I'm Marianne Cabot, and I'm a nurse health coach at OsteoSmart and Smart Life Medicine. I want to talk to you today about why it is so important for you to know your bone health status and why proactive bone health monitoring matters. We know osteoporosis is silent. Bone loss occurs without symptoms. Most people don't even know how low their bone density might be until they have a fracture. A simple bone scan identifies changes years before a break occurs when intervention is most effective. So this is just a slide to show you a little bit of what osteoporosis looks like in the bone. This is the spectrum of bone loss. So normal bone loss, you can see that it's nice, concentrated bone. But as we lose that bone mass, it's more aerated. So osteopenia is early bone loss, and it's a warning sign, whereas osteoporosis is severe bone loss, and it's more advanced and serious. We know bone density naturally decreases with age. So what we want to do and what it means for you is that you do something to prevent and reverse this bone loss. And I did say reverse. You can reverse bone loss. You have to know what your status is, and we want to do early detection. You don't have to wait until a fracture occurs to find out what's going on. So lifestyle changes can slow or reverse that bone loss. Strength training can improve bone loading and muscle protection. Nutrition, things especially like protein and calcium and vitamin D and K, can be optimized. Fall risk then can be reduced. So it's better to be proactive and to catch this early. If a fracture occurs, it really changes life. And I have seen this in so many people. A hip fracture or a vertebral fracture can lead to loss of independence, chronic pain, decreased mobility, and it has higher morbidity and mortality. So what we want to do is do prevention. Prevention is far less costly than recovery from a fracture, both physically and emotionally. We know bone is a metabolically active organ. Bone isn't static, it's living tissue that's constantly remodeling. There's the buildup and the breakdown of bone. What we want to do is monitor to help ensure that this bone formation is keeping pace with the bone breakdown. We know that hormonal changes can affect this bone breakdown and build up, especially in perimenopause, menopause, and in aging. Chronic inflammation or medications can also affect this. So what can you do? What we want to know is what our bone status is. So there's really three components. We need to assess our bone density. You have to get a bone scan in order to do that. Understanding your current bone density level helps predict the risk of fractures. And getting a bone scan is really the only way to know what your bone status is. Routine screening is recommended for women 65 and older and for men 75 and older. Early screening for postmenopausal women is recommended between ages 50 and 64. However, it is your choice. You can get a bone scan whenever you want, when you feel you need that information to keep you in the best state possible with your bone health and your overall health. So when we do early detection, we identify that bone density loss early, if there is any, and it enables you to do that proactive management to prevent further deterioration. Because remember, I said you can prevent further loss. You can build bone, even if you started to lose some of that bone density. And then also, being proactive with bone health monitoring allows you to evaluate the treatment progress over time. So if you do make lifestyle changes, how do you know if it's making a difference? So regular monitoring helps assess the effectiveness of these changes. And if there are any other therapies that you are doing, you'll see if they are helping or if you need to make adjustments or increase what you are doing. So I'd like to show you the choices you have as far as bone scans go. In this country, we have the DEXA bone scan, which is the traditional one that's prescribed, but there's another choice. There's something called REMS Echolight. First, we're going to look at the radiation exposure. In the REMS Echolight, there's no radiation exposure. It's radiation free. It uses harmless ultrasound signals, making it safer alternative for regular bone health monitoring. DEXA scans, on the other hand, are not radiation free. They rely on x-rays exposing the patient to radiation. The other thing is because the REMS Echolight does not use radiation, there really isn't a limit on how often you can have it done, whereas DEXA scan usually is prescribed about every 2 years. The accuracy is another thing to look at with the difference. The REMS Echo Light Bone Scan, it's less affected by your position, your posture, and any spinal changes. These can all affect the results. Studies have shown that 90% of DEXA scans have technical or positional errors. There can also be other artifacts like calcification or arthritis that can also create inaccuracy. Next is looking at real-time imaging. The REMS bone scan is non-invasive, and you will get the results right after you have the scan. You walk out of the office with your bone scan results. Whereas the DEXA scan is read by a specialist with results typically sent to your doctor within a few days to a week. So bone mineral density, or BMD, the REMS goes beyond just looking at that bone density mineral. It also evaluates bone strength and microarchitecture. This provides you with a personalized fragility score, which predicts your risk for future fractures. So both of these scans give you T-scores and Z-scores, but with the REMS EchoLight, you see the whole picture of your bone health. The DEXA scan only gives you those base scores, the bone mineral density, and it does not provide you that personalized fragility score. So you will know with the EchoLight your bone strength and architecture as well. We know osteoporosis can be common, but it's not inevitable. We know bone is a living, communicating organ that supports strength, metabolism, immunity, and vitality. You have a choice of what to do about your bone health now. Do not wait until you break to do something about it. Thank you.